107.1 MHz, musically yours.
The time bar studio clock is almost a minute past 9 a.m. We're on to break for listening to All India Radio's FM Rainbow channel on 107 Week. Like I mentioned earlier, it's Urology Week from today, that's 24th September, to the 28th of September. Urology Week is an initiative of the European Association of Urology, which brings together national urological societies, urological practitioners, nurses, patients, their families, to create awareness of urological conditions among the general public. And its goal is to raise awareness of what urology is truly about. And they also aim to start relevant discussions, introduce new technologies, insights, share experiences. And it's like an ideal opportunity to educate people to regularly check their bodies for symptoms. Like they say, prevention is better than cure. Prevention can actually save lives. And today in the studios, we have consultant urologist and robotic surgeon at PD Hindujah Hospital at Mahim, Dr. Santoshi Nagaonkar. Hi, doctor, and welcome to our show.
Hi, Bosco. Thank you very much. Good morning to all.
And okay, doctor, we're going to start off with our very first question. What all conditions are dealt by a urologist?
So I knew that it was going to be the first question, Bosco, because many people, they get confused between urologist and a nephrologist, because there are two different branches.
Right.
So in simple words, urologist is a person who deals with kidney, prostate, bladder, testes, and some other conditions, generally with surgical ways, as against the nephrologist who do it with the medicines, where the patients may need dialysis, and they also deal with kidney transplant. So urologists are people who deal with kidney stones, kidney cancers, prostate cancer, benign prostatic enlargement, and bladder conditions as well. So that's about the urologist is.
Are urological diseases such as benign prostate enlargement or prostate cancer, kidney and bladder cancer, they seem to be on a rise worldwide and also now in India? If so, why?
Absolutely right. There are various reasons. It's multifactorial actually. Unfortunately, about I think if I can recall, 20 years back, India and the Asian countries, they had very less incidence of these renal or prostate cancers, or they were not getting picked up at the right time. But lately we have been seeing that the incidence of these cancers is on a rise, especially in metropolitan cities like as we live in Mumbai. If you look at the cancer registry, Delhi actually tops the list of having the urological cancers, mainly the prostate cancer, followed by Bangalore, Mumbai, so on and so forth. The reasons are various, as I said. It is one is the environmental factor, where we are facing a lot of pollution in these countries.
Right.
There is no direct linkage actually established as of now, but that is one of the proposed reasons. Dietary factors, we have been moving from our traditional Indian diet to the westernized diet, preserved processed food, which is not good. And it's very interesting to see how historically this cancer evolution has taken place with regards to the diet. If I can just brief you about these dietary factors, how it was actually incidentally found out was in Japanese people, the incidence of cancer was extremely low, especially the prostate cancer. And few of the Japanese people, when they migrated to America or in Western countries, their incidence actually got equaled to the local Americans, and then they found out that probably dietary factors are playing a big role. So I would put diet as the biggest risk factor for any kind of urological cancer, or mainly the prostate cancer, I would say. The other factor is smoking. So in our medical practice, we have kind of a dictum where we say that smoking can cause anything and everything except pregnancy. So it's that bad, and it's just increasing the incidence of most of the cancers.
Right. What are the symptoms of prostate diseases?
So if you differentiate the prostate diseases into two different conditions, one is the benign condition, which is like a non-cancerous prostate enlargement, and the other one is the cancerous enlargement. So in benign prostatic enlargement, it's a very common condition. At the age of 60, about 60% of population will have this condition. Not necessarily they will have symptoms, but the symptoms are quite they are predominantly like slowing of the urine stream, dribbling. When they go to pass urine, they feel that they are taking long time. It comes in installment. They finish off urinating and they still feel that they haven't finished the job. These are the typical symptoms of benign prostatic enlargement. Having said that, these symptoms will also overlap in prostate cancer, but generally prostate cancer is an asymptomatic disease to begin with, and eventually it becomes symptomatic with the symptoms which I mentioned. Beyond that, they also develop bone pains, weight loss, loss of appetite. So typical symptoms of cancer are in prostate cancer.
Mm-hmm. And can one distinguish between non-cancerous prostate and cancerous prostate by means of symptoms? We'll answer that after we take a short break. We'll break into a song right now, and we'll be back with that answer.
107.1 megahertz, musically yours.
11 minutes past 9 o'clock. We're on to break for listening to All India Radio's FM Rainbow channel on 107.1. And currently we're in conversation with Dr. SANTOSHI Nagaonkar, consultant urologist and robotic surgeon at PV Hinduja National Hospital at Mahim. Doctor, my question was, can one distinguish between non-cancerous prostate and cancerous prostate by means of symptoms?
So Bosco, the answer to that question is no. In the initial stage, it is extremely difficult to distinguish between these two conditions, and the patient himself will have no different symptoms, and he would not be able to differentiate whether it's benign condition, cancerous condition. So even the medical people, they won't be able to differentiate. But having said that, as I mentioned, the benign prostatic condition, which generally occurs in 60% of men at the age of 60, they will start developing these typical symptoms where the urine gets slow, dribbling, the flow is reduced, they have to wait for finishing the urination. So these are typical symptoms of BPH, which is benign prostatic hypertrophy or hyperplasia. In cancerous conditions, though, it is asymptomatic initially, and eventually they will develop these BPH symptoms. Along with that, if the cancer is progressed quite in advanced stages, then they will develop typical symptoms like loss of weight, loss of appetite, bone pains. They may develop kind of unusual symptoms like blood in the urine as well. At times they present with kidney failure because their kidneys are obstructed due to a large prostatic cancer. So it's very difficult to differentiate in the initial stage.
Right. And but is prostate cancer a curable condition?
Absolutely. So for any cancer, we cannot use a blanket statement as curable. So we have to use it as a potentially curable disease. And the reason for that is in most circumstances, we need to find out at what stage the patient is presenting to us. So in early stages, these cancers, prostate cancer is potentially curable condition. So it is, if it is picked up early, then it is curable. So in all cancers, for that matter, we know most general people, they know that there are 4 stages of cancer, 1, 2, 3, 4. And if cancer is picked up in less than 2nd stage or before 3rd stage is reached, it is potentially curable cancer. And same thing applies to prostate cancer as well.
Mm-hmm. And there's something called the PSA test. Now, can that actually detect prostate cancer?
Absolutely, Bosco. That's a very, very good question actually, because it's one of the simplest tests one can have, and it can detect the cancer well in advance. Unfortunately, in India, we are still way behind in doing this test quite often. Of course, there is a lot of controversy about this test, whether it should be done as a screening test or whether it should be done only on people who need it. Mm-hmm. And that controversy has not yet been resolved. Having said that, I can give you some kind of overview about my experience. So when I was working abroad, 70% of patients coming to me with prostate cancer, they were in a potentially curable stage. The reason for that was the PSA test. The PSA test is done rampantly there. All the general practitioners, they are well aware of this PSA test and its importance and when to refer these patients to a urologist. As a result of that, the chances of finding potentially curable cancer was quite high there. And only 30% of patients were, like we used to say, hopeless. We cannot help them out in a big way.
Right.
In India, this equation is exactly opposite. 70% of patients coming to me now with prostate cancer, I cannot really help them out in potentially curing them. And the reason I would blame it on PSA test, which is not done regularly. So I think it is not only the general practitioners and local physicians, they need to get aware, but it is the patient's responsibility to actually request for this PSA test as and when they are approaching their 50s and 60s. As of now, there is no general consensus that when one should start having this test.
Right.
So if we look up at the US data, they say that at the age of 55, you should start doing this test regularly on an annual basis.
On an annual basis,
Correct.
right. Yeah.
And if there is any abnormality, you just go and see either a physician or a urologist directly.
So when does one really get alarmed? There are certain levels, right?
That's right.
So
Now,
when does one actually get alarmed? When at what level?
correct. So as a ball figure,
Yes.
4 nanograms is the cutoff line. So
Okay.
if the level is above 4, you should get alarm. If it is below 4, you can still wait and watch. Having said that, there are so many intricacies with the PSA test. So I would preferably get this PSA test to be interpreted by a urologist rather than even a general physician. The reason for that is nowadays we are looking at the age-matched PSA. So if I may ask your age, Bosco,
Right.
if you can tell me, I can tell you what should be your PSA. So in simple words, suppose I am now in mid 40s, okay?
Right.
So my PSA should be less than 2.5, between 2.5 and 3.5. If it is crossing that line, though the ball figure is 4,
Right.
for me, it will be still a higher value. So those are the things. So I think the best thing is the PSA test gets interpreted by a urologist rather than the patient himself or even the laboratory technician.
Right. Here's a very important question. What should one do if he or she notices blood in the urine? Now, can it be just ignored if it's a one-off episode? Or there again, does one need to get alarmed?
Correct. This is another symptom which has been ignored in a big way in our population. The reasons are multifactorial again. So we feel that blood in the urine is not an uncommon thing. We just pass it on and we just ignore it, but that's not true. Unfortunately, and we have to blame ourselves. I'm blaming our fraternity as well, because our medical practitioners are also taking it quite lightly, these particular symptoms. So when a patient comes with one episode of blood in the urine, many physicians, they will just write an antibiotic and they will send them off and they will say that, okay, everything will get fine. But that's not true. We have got so many patients, they come with one episode of blood in the urine and we find that they have a tumor in their bladder or in the kidney. So even a single episode of blood in the urine, or for that matter, if the urine test has been done and on the urine test there is some blood, which is a significant amount of blood in the urine, which may not be visible to the patient, but it's picked up on the urine test, needs to be investigated. And there are certain number of tests. They have to be done in a regular protocol. Once those tests are clear, then only we can confirm that, okay, this person is not having any sinister pathology. But yes, if there is even one episode of blood in the urine, especially if it is painless, if it is painful,
Right.
yes, you may be able to say that it may be contributed by stone or infection. But if
Right.
it is a painless blood in the urine, it needs to be evaluated further. Don't ignore it. And this is a message for the patients, the population, as well as to the local physicians.
All right, what we're going to do is we're going to break into a short song and an ad break, and we'll be back with some more conversation.
Party at the Rainbow.
107.1 megahertz, musically
25 minutes past 9 a.m. We're on to break for listening to All India Radio's FM Rainbow channel on 107.1. And right now we are in conversation with consultant urologist and robotic surgeon, Dr. SANTOSHI Nagaonkar. Doctor, what one should do, are there any risk factors for cancers of urinary tract, and can the cancer risk be reduced?
Again, another topic which is not being touched base quite often, and I like to discuss it with my patients as well, not necessarily only in general population. So see, yes, there are certain risk factors which have been established for urological cancers. Now, if you take the three main cancers of urinary tract, the urinary bladder, prostate and kidneys, so I can put the kidney and the bladder cancer under one heading, and the strong risk factor for developing these two cancers is smoking. That tops the list. Environmental factors are there, previous history of radiation.
Right.
Patients who are obese, they have got more risk of developing kidney cancer. Hypertensive patients, so those who have got blood pressure problem. And people who get exposure to chemicals, mainly those who work in chemical factories, paint industries or leather industries, they get increased risk of developing these cancers. Coming to prostate, it's a totally different ballgame. For prostate cancer, there is no identifiable cause as yet. So we can put it down to age. Aging is the strongest risk factor for developing prostate cancer. Certain genetics we cannot change. And nowadays we are finding more and more familial type of cancers where more than one family member is afflicted with prostate cancer.
Right.
So genetics is the second thing. As I mentioned earlier, diet plays a big role. And for prostate cancer, there has been a strong link developed between poor dietary habits and prostate cancer. So if you ask me how can we prevent it, there is no set protocol. We cannot prevent a cancer because I have seen non-smokers, absolutely healthy people developing bladder cancer, kidney cancer and prostate cancer as well. But you can certainly reduce the risk of developing these cancers by employing healthy food habits, regular exercise, reducing dietary fat intake. So anything which is bad for your heart is predominantly bad for your other organs as well in developing cancer. As far as the prostate cancer is concerned, there are certain diets which I strongly recommend to my patients if they start using that or start employing that kind of diet in their food. Probably they will either delay the development of cancer or they may not develop it. As I said, there is no established rule, but yes. So the diets which I say, the top of the list is the fruits or the vegetables with red content, so carrot, tomatoes, pomegranate. By and large, they have got antioxidants and they fight against the free radicals which promote the cancer growth.
Right.
The second thing is selenium. Now selenium is found in Brazil nuts. Brazil nuts are not easily available in India, but if you fish out from certain markets, yes, you can get Brazil nuts. Green tea is extremely good. Fish oil, where the omega-3 fatty acids, it's very important.
Right.
And soya bean in moderation. So these are some dietary habits which could be employed to possibly prevent prostate cancer.
Right. And what is the standard treatment for prostate cancer? We'll answer that after we take a short break.
अरे बहू मुन्ना कहाँ है? अम्मा मुन्ना खेल रहा है अंदर. तुझे जो मुन्ने के
Then welcome back. The time by our studio clock is exactly 9:30. Doctor, my question to you was, what is the standard treatment for prostate cancer?
So this is opening Pandora's box because prostate cancer is such it's a complicated subject. Forget about the patients and the physicians, even the urologists, they get confused. And so it's altogether a total specialty which has developed and evolved in the last few years. So The standard treatment, if you ask me, there are 3 standard treatment. So one is you don't do anything, don't touch it. Second is you do surgery, or third one is radiation. Having said that, don't do anything is a good alternative of treatment modality in certain kind of cancers. Earlier, they used to say that don't touch the prostate cancer. Patient is just going to die of a natural death rather than with prostate cancer. But that's not true anymore. So you have to identify the right patients who are suitable to go under this watchful waiting approach or active surveillance approach, where we just monitor these patients, make sure that the cancer is not getting progressed, and if need be, we intervene and try and treat the cancer at that stage. The second modality and third modality, they are pretty much at par. There is none better than other. So surgery or radiation, if you send me 10 patients with prostate cancer and five each, I send them for radiation and surgery, probably the cure rate would be pretty much equal. But they have got a huge difference in the side effect profile, and we have to actually customize the treatment for that particular patient. So it's not like a ball figure where patient walks in and you just tell them that you go for surgery or radiation. No, we have to take into consideration several factors before we can recommend a particular type of treatment. So yes, so watchful waiting, surgery, radiation, this is for potentially curable cancer. Once the cancer escapes out, when it is progressed somewhere else, then the treatment modality is different. Then we have to use radiation with hormone therapy or without hormone therapy. We have got chemotherapy. 15 years back, we had not too many options at our disposal for treating this patient, but now in the last 10 years, there is so much of research happening across the world, and we have got several things at our hand now to treat these patients as well.
And what is the standard treatment of benign prostate enlargement?
Okay, so again, benign prostatic enlargement, first treatment is watchful waiting. You just give some advice with regards to lifestyle modifications, water intake, when to drink, how much to drink, regular interval urination, all those things we can recommend. If person is still suffering with symptoms, then there are medications to improve their urinary flow by means of relaxing certain muscles in the body, in the urinary tract. And there are medications, of course, to shrink the prostate as well. But again, I see kind of unregulated use of these medications unfortunately, by the pharmacist, by the general practitioners, and even urologists. So it has to be, again, customized treatment for that particular patient. If somebody is not responding to these methods of treatment, then the next step is going to be the surgery. And surgery has been well evolved, and it has been established treatment modality. It gives tremendous relief from most of the symptoms, and we have got latest advancement in the treatment with technological advancement as well.
And what other urological conditions that are actually afflicting the common man? We'll take that after we take a short break. We'll break into a song. We'll be back with that answer.
Akashvani FM Rainbow 107.1 MHz. Musically your
Almost 39 minutes past 9 o'clock. We're on to break for listening to All India Radio's FM Rainbow channel on 107.1. We're in conversation with Dr. SANTOSHI Nagaonkar, consultant urologist and robotic surgeon. And my question before the break was, what other urological conditions that are afflicting the common man?
There are several conditions actually. We feel that urology just deals, or the urologist deals only with kidney, urinary bladder and prostate. It's not true. There are several conditions because it's a small area, but there is unlimited exposure to that. So besides the common urological conditions like BPH or kidney cancer, prostate cancer, bladder cancer, we have got kidney stone, which is a big population issue in India. Because of our climatic conditions and kind of dietary habits we employ. Urinary tract infections, female urinary conditions like stress incontinence, recurrent urinary tract infections is another issue, penile cancer, And of course, in lesser discussed topic is erectile dysfunction. That is also dealt by the urologist. Besides that is infertility. So in male part of the infertility is dealt by the urologist as well.
You're talking about kidney stones. Is there any non-surgical treatment to remove kidney stones?
Yes, so 30 years back there was only one treatment for kidney stone. Either you leave it, or two treatments: leave it alone, or you get it operated by a big scar on your body.
Right.
Just open up the kidney and take the stone out. But that's now historical. We rarely have to do those kind of treatment modalities. So nowadays we have got different options where we use laser to break the stone. We have got lithotripsy, which is like a external jackhammer, and that just blasts the stone to get it out. We do laparoscopic surgery where we just make a small keyhole on patient's body, get inside the kidney and remove as big as like 5 centimeters tumor or 6 centimeters tumor, from that small hole. So it has changed a lot, and there are certain medications which also facilitate passage of relatively small stones. So it has evolved a lot in the last 25-30 years.
Before we get back again onto urology, any specific dietary restrictions for patients who have kidney stones?
So this question often gets asked to me, not only by the patients.
It's a general question because a lot of people have this kind of a problem.
Exactly.
And yes.
Exactly.
Yeah.
And I do hear this question not even from the patient but also from patients' relatives as well,
Right.
because they want to know how they could prevent.
Right.
So there is no specific diet for that, to be honest with you. If there have been a lot of like data published that this can cause kidney stone or this can potentially, but there is no proven data. You may be eating a kilogram of tomatoes every day, but you may not form kidney stones. As
Right.
against somebody who is totally having aversion for tomatoes, he may form kidney stones. So
Right.
there is no specific thing, but I tell my patients only 3 things. Number 1 is increase your water intake. Now there is no set limit for water intake. Everyone says that between 1.5 liters to 2 liters is fair enough, but see,
Right.
that is not true for somebody who is working on street or somebody who is laborer. He may be sweating out 5 liters of sweat every day, and he may
Right.
be just gulping only 2 liters. That's not enough for him.
Right.
So ideally it should be over and above your urine output, which is impossible to actually measure. So you have to know your own body and find out how much is adequate fluid. But roughly I would say 2.5 liters of water is required. But if you're a recurrent stone former, you may have to increase it to 3.5 or up to 4 liters. But I will not go beyond 4 liters because then that puts a lot of pressure on kidney as well.
Right.
That is one thing. So increase your water intake. Second thing is salt restriction. Salt is historically been known for causing all bad things on our body. It can cause kidney disease, but along with that, yes, it increases or it enhances the calcium deposition inside the kidney. So salt restriction is important. And third thing is you can increase your citrus fruit intake or juices, basically like lemon juice or orange juice, and that will reduce the possibility of forming kidney stones, provided they don't have a particular type of kidney stone which is called uric acid stone, which forms in acidic urine. So
Right.
once that has been ruled out, then you can put someone on these 3 basic things. Otherwise, I just tell them to have a balanced diet.
I think that is what is most important.
Exactly. So less in red meat intake or any meat
Right.
intake. Too much of seafood is also bad. Too much of green leafy vegetables can cause stones. So if you have balanced diet and if you follow these 3 things, I think it's pretty fine.
Right. Thank you so much. And now, what recent technological advancements happening in urology, and is our country ready for it?
Oh, there are lots. And urology is one branch, I think, which is been growing like anything as far as the technological advancement is concerned, and they are leading actually in most of the medical fraternity. So as far as if you ask me, the benign prostatic condition is concerned, where patient's prostate is enlarged, then the standard treatment has been something called as a TURP, which has been there for the last 35-40 years and has stood the test of time. But in the last few years, in the last 2 decades, we are moving away from that procedure to the laser treatment. And laser treatment is relatively painless, bloodless, the hospitalization time is less, and that has definitely evolved over a period of time. Urologists have tried several laser machines, because laser is not one laser. There are different types of laser, like
Yes.
CO2 laser or green light laser or holmium laser. So we have to find which laser works better for prostate, and now they're settling in somewhere. So laser is evolved.
Mhm.
As far as the cancer is concerned, it's just the sky's the limit. Now we have got minimal invasive approach. So 35 years back, the standard treatment for cancer was cut open the abdomen and take the cancer out.
Mhm.
Then we moved over to a keyhole surgery, where you just make tiny keyholes on patient's body, put the endoscope inside, remove the tumor, and take it out from a small incision. In 2000, actually, in about 18 years back, one of the urologists from the US, he did the first robotic prostatectomy. Now, what is robotic prostatectomy? It's like opening up again a Pandora's box.
Right.
And that is something which has happened in the last few years.
Mhm.
Your second question was, are we ready for it?
Right.
Yes and no.
Mhm.
We are still about 10 years behind schedule from the world, and the technology is there, but it's not available as frequently or in as many hospitals as we would like, because there are so many benefits of these newer technologies as well. And that could be because of the cost factor to an
Right.
extent, and less awareness amongst the physicians and even the patients about these technologies.
Mhm. Another question, I was going to ask you about this a little earlier. How is laser treatment better for benign prostate conditions? We'll answer that after we take another short break. We'll break into a song as Michael Bublé with Haven't Met You Yet. We'll be back.
Akashvani FM Rainbow 107.1 megahertz. Musically yours.
52 minutes past 9 o'clock, we're on to break, listening to All India Radio's FM Rainbow channel on 107.1. And right now we are in conversation with Dr. SANTOSHI Nagaonkar, consultant urologist and robotic surgeon. And doctor, my question was, how is laser treatment better for benign prostate condition?
So Bosco, the medical field has been so interesting. They always like to hijack the ideas from different things. So we have been watching these movies, James Bond movies, where the laser has been used to destroy the enemies and destroy the even they can do it for cutting open the body of James Bond. But the medical field has taken it in different perspective. We have been using lasers in different intensities, different
Right.
wavelengths to treat medical conditions. So if it is used in the right kind of wavelength and right kind of intensity, we know that it causes least of the tissue damage. Mainly we are worried about damaging the surrounding tissue. If we have to take out an organ from the body, that organ has to be removed without damaging the surrounding tissue. And laser has played a big role in doing so. So when we use these lasers in doing prostate surgeries, basically it causes least damage to the surrounding tissue. So it is bloodless, first of all. It becomes relatively painless procedure. And even it causes some least complications as against the standard treatment, which is TURP. So it causes less possibility of developing sexual dysfunction after the procedure. Or there are something called as a chemical imbalance, TUR syndrome, what we call.
Right.
That is not possible with laser. So yes, definitely laser has got a lot of advantages. Patients who are on blood thinning medications and who cannot stop their medications because of several heart conditions, laser has been a boon for them, because you don't need to stop these medications in these patients and you can still go ahead and do this procedure on them.
Right. Doctor, what is robotic surgery? You also go as a consultant urologist and robotic surgeon. So what is this robotic surgery?
Wow. So that's another exploitation from the medical field, using robotics in medical field. So if you recall a movie called Inner Space, very old movie, but it's fantastic. So where the miniature people, they were actually injected in patients or person's body, and they just wander around inside the body. Now, robotic is not like that, but you may get a feeling when you operate through a robot or with a robot, you may get a feeling like that. So robotic surgeon doesn't mean that I'm operating on a robot, but I'm operating using a robot. It's a master and slave technology. So the robot will not move unless until the master, who is a surgeon, will give him a command. It's a relatively large equipment, and it has just changed the face of the surgical field in the last 16, 17 years. Of course, in India, we are a bit late to take it up, this technology. But in Mumbai, we have several hospitals now. They have this technology available. So see, the robotic technology is an advancement of keyhole surgery.
Right.
So historically, the keyhole surgery, or still, I shouldn't say historical because otherwise few of the laparoscopic surgeons will get at me. So the keyhole surgeons, they insert tiny cannulae through the patient's abdomen, and then they operate and remove the involved organ or involved part of the body.
Right.
Now here, these cannulae are connected to the robotic arms. These robotic arms are totally controlled by the surgeon. The beauty of these arms is these arms, they go inside patient's body, and individual arm has got a wrist, which is not possible with the standard laparoscopy or keyhole surgery.
Okay.
You can imagine you putting through a keyhole your entire wrist inside and then operating with a 10 times magnified 3-dimensional view. So what you and me see now is not a 3-dimensional vision, it's a pseudo 3-dimensional vision. But what the robot gives me is a real 3-dimensional vision. So this endo wrist, now your wrist, if you move it, it moves 360 degrees, but this endo wrist has got over 560 degrees of movement. So it can go in every nook and corner of the body and it can operate. So it's extremely precise technology. Virtually, I wouldn't say bloodless, but the blood loss is extremely low. It gives a better vision, less pain relief medications, early recovery to work. Of course, I may sound like a marketing guy, unfortunately.
No, but that's how it is kind of beneficial than a conventional surgery.
Absolutely.
Right?
Of course, conventional surgery will never go out of window.
Right.
It has got its own place. But there are certain conditions, especially in cancerous conditions, the kidney, bladder, prostate. Prostate is a biggest advantage because prostate it's a small organ, it sits behind your pelvic bone, inside the pelvis, and open surgery is extremely difficult.
Right.
But the robot is fantastic in reaching into that corner. And besides urology, this technology is used and exploited by almost all different specialties like colorectal, hepatobiliary, gynecologists. So it is there in almost all specialties, the robotic surgery, and it's a big advantage over conventional surgery.
Right. Doctor, thank you very much for joining us in the studio and sharing all your inputs. Today happens to be Urology Week from the 24th to the 28th. And with us in the studio, we had Dr. SANTOSHI Nagaonkar, consultant urologist and robotic surgeon at the Hinduja Hospital. Thank you once again for joining us and sharing all your inputs.
Thank you, Bosco. I appreciate it. Thanks for giving me this opportunity.
You're most welcome. Thank you so much.
Thank you. It's all done?
Yes, all done.
Perfect.
I'll just get one more thing. Just put those headphones on.